probably heard of or know someone who's had surgery go drastically wrong. We all hope that it won't happen to us, but really, how common are these frightening mistakes these days? According to the LA Times and Washington Post, a study in the Archives of Surgery reports that the problem may be 20 times more common than previously thought, and that prevention efforts may be very inadequate. The Joint Commission on Accreditation of Health and Patient Advocacy Groups have tried to eliminate such mistakes by having doctors and patients review and verify the procedures beforehand. When the Insider Exclusive investigated 4 separate databases, including the Federal National Practitioner Data Bank, a repository of malpractice payments and disciplinary actions, their records clearly showed that surgery mistakes occur between 1,300 and 2,700 times a year in the United States. Wow, that's a lot of unhappy and critically injured patients, and injured by doctors. Today, the Insider Exclusive investigates the horrendous surgery malpractice story of Lázaro Perez, and how the Palm Springs General Hospital and Dr. Juan Julio Hernandez Pombo totally botched a rather common surgery and nearly killed Lázaro. In fact, in order to save his life, he had to be transferred to another hospital. In 2010, nearly 90% of all gallbladder surgeries are performed using a method known as laparoscopic surgery. Surgeons now consider laparoscopic gallbladder surgery to be the gold standard when removal of the gallbladder is necessary. On the screen, as you can see, one of the most common techniques for performing this procedure is begun by making a small incision near the navel and inserting a needle into the abdominal cavity. The cavity is then inflated with carbon dioxide gas. This distension allows for easier viewing and creates a workspace for the surgery to be performed. The needle is then removed and a sharp, hollow metal cylinder called a trocar is inserted in the now inflated abdominal cavity. The laparoscope is equipped with a camera that allows a magnified view of the inside of the abdominal cavity to be projected onto the video monitors located on either side of the operating table. Once the laparoscope is in place, the abdomen is examined to ensure no injuries resulted from the placement of the trocar. 3 additional trocars are then placed into the abdomen through small incisions under direct observation through the laparoscope. It is through these ports that various surgical instruments are inserted for manipulation and dissection. The surgeon then watches the monitor and performs the operation by manipulating the inserted surgical instruments. In the typical procedure, the end of the gallbladder is pulled upward toward the diaphragm. This allows the cystic duct, the cystic artery, and the common bile duct to be seen. Once these structures have been clearly identified and dissected away from the surrounding tissue, the cystic duct is sealed with a clip placed near its junction with the gallbladder. The surgeon then places 2 more clips near the point where the cystic duct joins the common bile duct. The cystic duct is cut and separated between the clips. The cystic artery, which provides the main blood supply to the gallbladder, is then divided in the same way. In performing this procedure, the surgeon must be meticulous, for the cardinal rule of all gallbladder surgeries is that no anatomic structures are clipped or cut until the surgeon is unequivocally certain that they have been properly identified. Now, surgeons can either do this the right way or the wrong way. And in Lázaro Perez's case, Dr. Pombo did it the wrong way. The right way is when the gallbladder is finally removed, the surgeon identifies and cuts the right ducts and avoids cutting or nicking the wrong ducts. These ducts are small and close together, and when a doctor who lacks the proper training or skill improperly identifies the ducts, the results are cases like Lázaro Perez. The duct that should be cut is called the cystic duct. The most common mistake made during laparoscopic gallbladder surgery is cutting of the common bile duct instead of the cystic duct. And that is what Dr. Pombo did exactly. And when that happens, it sends bile into the patient's abdomen and in effect poisons the patient. Incompetent or negligent surgeons like Dr. Pombo, who rushed to perform this money-making surgery, pose a serious risk to patients and to safe medicine. This year, more than 1 million people in the United States will learn they have gallstones, and approximately 75,000 will need surgery. And one of them could be you. Out of the 75,000 gallbladder surgeries this year, approximately 1 out of every 200 patients will likely develop a bile duct injury. Compared to the traditional surgery, the most modern gallbladder surgery procedure can cause up to 10 times as many bile duct injuries. Lazaro Perez is just one of the 200 very unfortunate patients who, through the hand of fate, met up with Dr. Pombo, who had only performed 1 or 2 laparoscopic gallbladder removals prior to the one he attempted on Lazaro. Plus, he had been previously sued in the Midwest by a patient for the same procedure, which also went bad. Today, the Insider Exclusive presents Surgery Mistakes, Lazaro Perez's nightmare story, and how his lawyers Stuart Greenberg and Mark Stone, partners at the law firm of Greenberg and Stone, got justice for Lazaro Perez, earning them the highest respect from citizens and lawyers alike as one of the best plaintiff trial lawyers in Florida and in the nation. They have seen many innocent, hardworking people suffer needless injury at the hands of incompetent and negligent doctors, and because of that, they are driven to help people who have been harmed by the negligent actions of others. Their goal, not only to get justice for Lazaro Perez, but to make sure healthcare is safer, and also to hold hospitals and their insurance companies much more accountable. Hi, I'm Steve Murphy, and this is the Insider Exclusive, live from Miami, Florida, at the law firm of Greenberg and Stone.